I think we owe it to our patients to be able to demonstrate our competence. I think that all of us need to be able to answer their questions and show them that we've had the appropriate education and that we can pass a bar for practice. And the CWS lets us do that. And I think that it behooves everyone to get this advanced credential so that you can show that you are a competent practitioner.
Given the rising prevalence of diabetes and obesity and people living longer, there's just been an explosion in the number of patients with chronic wounds. And because of that, there is a incredible need in the community for people that are specialized just in wound care.
I think that the trend nowadays is to have certification, especially in wound care, which is a growing field. If you don't have certification, I think you're going to be behind the 8 ball, both from a credentialing point of view as well as from an economic point of view.
I challenged myself. Although I'm a nurse, I wanted to be tested among my colleagues in the interdisciplinary world, and it's the same exam that a physician sits for and the same exam as a physical therapist and a nurse sits for. So by far it has challenged me and I believe catapulted my career in many ways.
There's a common respect that you see between practitioners, and because we are a multidisciplinary organization, it's important to have input from therapists and from nurses and from physicians and podiatrists. Everybody has their place and their role in healthcare, and it makes wound care actually a much better entity when you have input from all those different folks.
It has definitely opened up a network for me as far as different physicians, podiatrists, nurses of different levels, physical therapists, even social work for that matter, just a lot of different health disciplines, really again with the common goal of providing the best wound management for our patients.
I tell you what, just looking at this whole process from a healthcare professional's perspective, I'd say you want to essentially identify a way in which you can demonstrate to payers, to insurance companies, to healthcare institutions, and most importantly the patients, that you have the knowledge and the ability and the experience.
If I were to think about why someone would be certified, it's because I think it sets you apart. It gives you the ability to show the medical community in which you work that you have taken that extra step to not only have the training and go for the continuing education, but also to sit for a rigorous examination.
To become certified not only allows you, if you're developing your own business, to be able to validate your level of knowledge to others, it also instills confidence into your patients that you respect that learning is ongoing and that you want to be able to deliver the best of care to them.